Go right ahead.
Good morning, everyone, and welcome. We see you slowly joining in with us. Welcome to Vernon and Maury and Bruce. Glad to have you. We're here at the LA Metro Chamber virtually. I'm Shanna, and I'm the CEO. And as a gift, really, to folks who are attending, we always start you with mute and your video off. So you're able to change that on the bottom left hand of your screen. When you scroll your mouse down and go to the left, there's a mute button and a video button. We're going to allow you to unmute yourself unless the size of our participant group gets too large, in which case I would turn off that feature. So if you would like to turn on your video or to turn on your audio so that you can ask questions to Ralph or I directly, then you are welcome to. We're going to let folks join for a couple of minutes, and we'll get underway probably in 2 or 3 minutes from now. So welcome. If you haven't used Zoom before, another feature that I will introduce you to and that we will use in the course of this webinar and presentation is the chat function. So when you scroll to the bottom of your screen, there's a big green arrow button, and directly to the right of that is a little chat box. When you click on that box, you're able to see messages from everyone, but you're also able to type a message in. This is how we can ask questions and track those questions and make sure that all of them get addressed as time allows. And so I'd encourage each of you at this time to enter your name and your business name in that box so that we know who's in the room. Welcome, Bob.
And thank you all for joining. This is Ralph. I guess you can all hear me, so we'll start momentarily, and appreciate you all joining the session.
And Ralph, I'm happy to share a little bit of your bio as we get underway.
Sure.
Make sure folks know who's here.
Okie doke.
Welcome, Katie.
Hi, thank you.
Yeah, I'm glad to have you with us. We're using the chat box so that we can kind of log in questions and make sure they get addressed. If each of you could enter your name and your business or organization affiliation, that would be really helpful for us and Ralph, the presenter, who I'll introduce momentarily, to know who's in the room. I'm happy to model that for you. There you go. Welcome, Vernon. And we are recording this. We're going to be able to share it with folks after today or even later in today, which is our real goal. Maury, welcome from CDI. Katie, how are the animals doing? Good. I'm glad to hear that. We'll give it another minute or 2 and then we'll get underway.
And if anyone is joining in their pajamas, we understand that we're all working from home, so there's no issue with that.
I've coined a phrase for that. I call it the COVID mullet. It's when you're business on top and casual on bottom.
And then there's the COVID-15, which is the 15 pounds you gained by working at home for a few weeks.
Yeah, exactly. I think that's
right.
True.
Great time to start a diet or stay on one.
Yeah.
I moved my camera so you wouldn't see the kitchen behind me. That's how close I am.
Jack, welcome. It looks like you can hear us, but we won't be able to hear you. So you'll want to make sure that you're able to use the chat box at the bottom to ask any questions.
Now, Shanna, I cannot see the chat box at the bottom.
I can
So-
monitor those questions for you because you've got a lot going
Thank you
on
so
your
much.
screen. Yeah, absolutely.
Okay, no problem.
And I've got just a minute or two after 11, so we'll give it another minute and then we'll get underway. We'll welcome folks as they arrive, but I want to make the best use of your time, Ralph, and everyone else's.
If you want to make it interactive, Shanna, you know, with a dozen or so, 12, 15 people, that's fine. That works. Gets a little unwieldy with a larger group, but I'll leave that up to you.
Yeah, I'll monitor that and I'll turn off the ability to unmute if that becomes an issue.
Okay.
I also note not everyone feels comfortable speaking on one of these, so you're welcome to place any questions that you guys have for our presenter, Ralph, in the chat box. You can share it to everyone or you can share it to simply me, and I'll raise those questions for Ralph so that he can really focus on his presentation as we go. I would say you do each have the ability right now to unmute yourself if you do want to ask a question directly. We start each of these with your audio and video off and give you the ability to turn it on. So should you want to be seen, you can activate either your mute or your video by rolling your mouse down across the bottom of the screen that you're viewing us in. And the mute is to the left and the video is right next to that. And by clicking on either one, you'll be able to participate more fully. But that's a completely personal choice, one we want to offer. Okay.
Hi, Jack.
So let's get underway. I'm going to offer a couple pieces of just kind of how we manage and some context. And then I will also give you a little bit of information about Ralph, our presenter today. So Ralph Petty is joining us, I think, remotely from New Jersey, if I recall. And of course, my dog's going to bark right now. One moment. Sorry. Ralph is a certified risk manager with an emphasis on business continuity planning for the SMB and enterprise markets. He's someone that was selected by the International Medical Corps for pandemic planning in the Philippines and Indonesia. Mr. Petty is also focused on the critical supply chain and crisis management areas that are integral to keeping all businesses running. We've been having a lot of conversations in our office, Ralph, about supply chain needs in Maine, and so I'm excited for that portion of the conversation. I'm going to go full screen. You all should be viewing the slides that Ralph is sharing with you. He'll be advancing those as he goes. I'll be monitoring questions in the chat box, and if you haven't found that yet, you scroll to the bottom of your screen, and next to the bright green arrow is a chat function. I'll mute myself and invite Ralph to take over. Ralph, thank you so much for joining us today.
Thank you, Shanna. It's my pleasure. And good morning, everyone. Thanks for joining. Some colleagues I know, some new colleagues I know, some new friends that I'll get to know, but we're all in a quandary. We're all working from home, and we're all watching the news, all the different channels to get an adjusted, coagulated opinion. And we're doing all that we can to just hang on tight, as the president and some of the experts last night said that things might get a little rougher before they get a little better. And it's a tough situation. But before I get into all that, I just want to thank the Lewiston Auburn Metropolitan Chamber of Commerce and Readiness Associates for sponsoring me to present today. We have an hour. We're going to have a comfortable chat. We're not going to get down any doom and gloom or be too optimistic. We're going to be realistic in our discussion, because I've been through over 500 disaster events, and this is another one. And you know, when the chips are down, you got to just look up and make sure that you're one of the people that's working on the solution rather than someone running away from the problem. And that's probably the way we should live our lives in general. But I just think that it's something that really applies, as we've never, as a country, experienced anything like this, and we've got to be strong and steadfast, and also care for our elders and our neighbors. So the subject is coping with the current pandemic by using business continuity all hazards planning. And we have about 30 slides. We'll define what that is in painstaking detail. I'm sure you'll all get a copy of this at some point. But the key is that business continuity really means continuing the business. Gee, that's going to be the first question on the quiz when we're done. And business continuity means that you have to keep running your business no matter what. So the restaurants that are troubled these days are working extra hard to be making deliveries or serving one person at a time, 6 foot apart, through their side door. And the transportation companies are using their best sanitation efforts and so forth and so on. But some people, like the dry cleaners and other services that are not able to contribute directly, have gotten creative. And you look at some of the major folks that have been on the news lately, where you've got companies absolutely retooling and coming up with brand new ideas, where they might have been making wine on Monday, they're making sanitizer on Wednesday, if they have the capability to do so. So it's a whole new world. And my concluding remarks, I'll say them 3 minutes into the Shanna. And the bottom line is that the world will never be the same. And we'll talk about that. But the key is to get ahead of it. And even though you might be sitting there without a formal business continuity plan to run your business, you might be backing up your data. You might be doing something that keeps you comfortable at night, that, gee, I have what I need to move forward. But we're going to dive in a little bit and make sure that you understand the differences, the very subtle differences between crisis management, emergency management, crisis communication, working with public-private sector organizations. And guess what? The example we can use is sitting 30 feet from us in the street in front of our homes, where the police officers and all the other dedicated people are doing their best to help us out of this quagmire and doing whatever they can to be a resource for us. The all hazards component, and don't worry, I will get to the other slides. The all hazards component really speaks to the fact that when you do your planning, you plan for any possibility. Some plans plan for a fire, a flood, a terrorist event, a cyber attack, whatever it may be. But we like to think that you want to do all hazards planning. You want to plan for the elements of an event. The loss of power, which is always number one. The loss of resources, your personnel. The loss of personnel being on an airplane and not being able to contact them for 5 hours when they're flying to Seattle and something's happening back in your office. The loss of telecommunications, communications, facility, resources. And as Shannon said earlier, she's interested in the supply chain aspect. And that could be the most overlooked aspect of all, because the supply chain is something that you're looking to get the delivery of those clothes or the delivery of the milk for the coffee shop down the street, or something so predictable and mundane that it comes in every day. But when there's a little bit of a hiccup, you've got to have a plan B, you've got to have a plan C, and we'll talk about all that. So I'm going to advance the slides, and I'm sure everybody can see that. There's my smiling face. Did you notice that Shannon and I both have the same color shirt on today for some reasons? I'm actually in Washington, D.C., so we're a good 600 or 700 miles apart, but somehow the instant karma is going to get us, and we're doing fine. So there I am, and you heard my bio, and something to be proud of. So again, a credential to Readiness Associates. They're working with a lot of companies, primarily in the healthcare space. They're also looking to partner with folks in other areas. They're a wonderful organization focused on the ability to provide crisis response, a bunch of former Red Cross folks, and they have a nice story that they tell. They're a local company in Maine, and I'm a resource working with them, and it's just a situation where we take a look at emergency management to make sure that we do whatever we can to be successful. By the way, my daughter is 9 months pregnant, and if my phone rings and I have to hand off the presentation to Shanna, you'll understand that I need to run. I just got a message from someone else, but I am looking at my messages, so if I glance down, you'll see me be distracted for a moment, but that's a darn good reason. So when you look at a company like Readiness Associates or other companies that are out there, they're providing services that are based on existing regulations. You want to do things that are standards-based as you prepare your plans for your own companies. And when I speak to companies, I'm talking to a mom and pop shop, an SMB firm that might have 25 or 10 or 5 employees, and I'm talking to major companies that have 50,000 employees in 100 cities worldwide. It's all boils down to the same thing. You want to make sure that all your stakeholders, all your employees, all your processes and procedures are based on standards, based on best practices, based on all the different regulations out there, Sarbanes-Oxley or HIPAA or any of the other Graham-Leach-Billy, any of the other regulations that you should follow. So if you're a small accounting firm with a handful of people, which my accounting firm 30 years ago started out to be, they were complying with the regulations. They knew what they needed to do. They had the reporting requirements. Now that they're 1,200 clients strong and a staff of 30 or 40, they're doing what they did before, only with greater risk and greater participation in those standards. And that's the way it is for all of you companies. Many companies right now are wondering, gee, what should we do? We're in the middle of a pandemic. It's too late to make a plan. And the example I've been using for 3 weeks now is we're 3 weeks into a probable, maybe even 3-month period, or hopefully a lot sooner, is that you're in a canoe and you lose your oar. Do you just crash into the shore and get out of the ship, get out of your canoe and say, all right, I'm done? Or do you just try to find another oar and keep paddling and keep focused on your objective? That's what this is all about, helping everyone think that through. So now that I've just summarized the presentation, let me show you what the agenda is going to look like. This is officially your welcome and overview. And now we move on. So business continuity, as I said, needs to be your focus. The difference between business continuity and disaster recovery is you're backing up your data, you're not backing up the processes of your business. And we'll dive into that. And how are the pandemic events affecting your business? We'll give you some good examples. And we'll go back a month or two to see where the people were saying back in February, gee, this looks like it's going to be serious. And here we are 5 weeks later, and we know what's going on in the front row. What can you do about it? What's right and to keep your business going? What about your supply chain? What about public-private sector interaction? And then we'll give you some bullets and some things to take back with you. And as I say in every presentation I make, and I've got 3 other presentations in the next 2 weeks I'm making. One is to a group of companies in Israel next week, and another one is to a group of insurance agencies all over the country. There are so many different things to consider, but everyone on this call and everyone that gets on this website and hears this link to this presentation someday should look in the mirror and say to themselves, I heard a presentation, I got some good ideas, I'm going to act on them. And especially now that we're all in our homes and that we're all sequestered for a period of several more weeks, and our phone and our internet are our lifeblood, we really have to be very efficient in what we do, and we have to make sure that we act on what we're doing and try to build plans and do whatever we can to be successful in our companies and keep them running. So that's our theme today. So we go to the slide that talks about what do we know about disasters today. And disasters today are very interesting because in the old days, when I got into this business 30 plus years ago, my joke has always been we used to chase the fire engines to find out where the fires were. But now, even before the pandemic, even before the COVID-19 virus popped into our lives in January, there were other disasters. There are snowstorms, there are fires, there are floods. Every region of the country has its danger. Did you know that St. Louis is the 4th most likely city in the country to have a disaster? Nobody knows that stat except the real hardcore people in this business, and I count myself as one of them. But you've got the hurricanes that hit Florida, you've got the Gulf region, you've got the San Francisco, California earthquakes and the fires fueled by the winds of the Santa Ana winds every year. But St. Louis, in the middle of the country, in the heartland, sits on the Mississippi River, and they flood every single year. We see those pictures. And St. Louis has the actually the most active link earthquake fault in the country. It's called the New Madrid Fault, spelled like Madrid, but the New Madrid Fault. And then we throw in a few tornadoes here and there, and you've got St. Louis as a place that is not insulated from a disaster, as many other places think they are. Anybody can have a terrorist event. Anybody can have a cyber event, but specifically on the geographical side, it's something that you have to consider wherever you are. So in Maine, you've got your ice storms. You had a hurricane come through a few years ago that upset a number of the roads in Vermont and New Hampshire, and it spilled over into Maine. You've got the nor'easters that happen. You're resilient and you know what to do, but you have to understand where you are and what you're doing everywhere. So the education of your employees and working with your insured people, as it says, is critical. You've got to make sure that they're there for you, that you look ahead of time. And we'll talk about your insurance needs, because right now, cyber is not included as something in the force majeure. So if you've got a force majeure policy that says, oh, well, if it's an active nature, something that I couldn't really anticipate, and you think cyber is in that category, you're wrong. because the insurance firms are saying that 90% of the companies in a given year could be affected by cyber attack in some form or another. And it could be as simple as someone in your office clicking on the wrong link to an offer from someone as well known as Staples or someone else, and all of a sudden it's phishing or it's something that's going to impact you. So you have to really look at your insurance policies and make sure that your extra expense insurance and your business interruption insurance are critical. We talked about support resources. Are you really ready? And the last bullet says anything can happen to you and you have to be prepared for it. So without business continuity plans, 80% of all businesses, according to IBM, will go out of business, may go out of business in just 2 years. That was a dramatic pause for 3 seconds. You know, you look at that picture, and that picture could take place anywhere in the country of all these different items. That's why we selected these slides. So your business could be, there was a client of ours in Northern Maryland that was a mortgage refinancing organization. They built this beautiful, beautiful building. It was all glass, no basement, and all the cubicles and the offices were set with simple partitions, but they were proud of the fact that you could be leaning on one wall and looking out the other wall and see the outside of the building, and right clearly through these beautiful fields. Well, they wanted us to put together a business continuity plan for them, and they had literally no place to go in the event of a weather event or a tornado. They had no basement. Their 4 stairwells were in the 4 corners of the building. They did not have an interior infrastructure. Ever since September 11th, they're building buildings now with segmented infrastructures per each floor. So there's fire suppressant in the new buildings on each floor. And also they're putting the tiers of the elevators and the fire escapes and the stairs all on the interior of the building, so they're not compromised on the exterior of the building. So think about where you are, your building. Think about your supply chain partners. Think about where your spouses or relatives work, where they are. Just as we're staying home and being indoors and working together to make sure that we can flatten the curve and survive this pandemic, think about the people in your life that work in that type of building or have that kind of jeopardy, especially those that are in critical businesses that need to understand that they might be a risk for something that could happen. And the small businesses, those are the ones that really need to do the planning. And I'll give you another example. In Philadelphia, they built the Comcast Tower, and they had a 10% spend of an $800 million budget to provide the small businesses, the minority and all the others. And these businesses did not have the business continuity plans to keep the company, to keep the infrastructure and the 3-year project going, and they had to find plans. So everybody needs to consider a small business plan to stay in business and do what they can. So as I mentioned earlier in my overview, the key is that we don't plan for a fire, we don't plan for a flood, we don't plan for a cyber, we plan for these factors. And everything on this slide, and I've checked my sources, has happened in Maine, since we're being hosted by the organization right now. And we are looking at partnering with the Readiness Associates organization right now in Maine. All of these things have happened, even in the last year. And you have to look at where everyone is. There are people on this call I know from Maryland, from New Jersey, from Florida. And as I speak to those folks, or I've met with those folks previously, anything can happen in a given area. And I said the loss of personnel, item number 2, it should be item number 1, but power is 80% of the time the culprit. But loss of personnel could be as simple as someone in a leadership or management position being on a plane and not being able to be reached for quite a bit of time. And then they're able to plan and call and say, oh my goodness, I just heard what happened. What did you do? Well, Mr. President, we followed your plan. We did what you said we should do, and we acted on it, and we're stable. And that's the best news, because they had a plan ahead of time. So when there's a disaster impact, you have to consider these factors. So what do you do about these? You consider, unfortunately, we'd speak about September 11th for a moment. The building actually, in the layman's terms, for a business continuity professional, was the loss of facility, the loss of personnel, the loss of communications, and all the other factors on this list. The key is that the power still was in the street. The personnel, Goldman Sachs could do their work from Tokyo or Singapore or somewhere, or London overseas. The facilities, there were plans. You have to think, even for a small business, where are you going to go? Who are you going to call? What are you going to do? And we'll get to that a little more. And all of a sudden, we have this pandemic event. And it's something that is terrifying, but it's an opportunity for people to really reflect and say, okay, I'm going to pull up my bootstraps and do what I can to survive. And that's got to be the attitude, because I think we all share that. If you're on this call, you're interested in finding out what the solutions are. And there's a lot of solutions. We just have to act on them. And one of my favorite terms is act decisively and make a difference. Because even though you're in that canoe and you're a third of the way down the river and you lose your canoe, you hit a rock or a tree limb or what have you, you have to find another oar in your canoe to make sure that you can keep going. And that's what we're doing here. So what happened? It's been an unprecedented a situation. It's been called somewhere between a 9/11 event and World War II. Look at the impact it's had nationally and the feelings we all have about it, and look at the mobilization that's happened that really we haven't seen since World War II. The nation has mobilized significantly. There are some cities. I put this presentation together on Saturday. We reviewed it on Sunday. We edited it on Monday. It's now Wednesday morning, and things have changed in a great regard to this presentation of just events of the last 24 hours, where maybe it might say in this presentation that we were going to have to hunker down for a month or so. Well, now we're talking about 6 weeks, 8 weeks, and even further. So we're trying to safeguard 350 million Americans and many, many people all around the world. And if you're a major company, I looked at the profile for the Chamber of Commerce, for the Lewiston Auburn Chamber of Commerce, and there are folks that are members of the 700 or 800 members that are in the healthcare profession, that are in the power area, that are in different utilities, that are members of the chamber. And if there are companies that are there, major corporations as there are, that do have offices all around the world, they're not only scrambling to protect their U.S. offices, but they're scrambling to see what they're going to do overseas and how that's all going to come to be. So it's something that we need to do to make sure we look more globally beyond what's on our shores. So it has impacted our way of life. We all know this. You know, we're sheltering at home. There's no more travel planning. We've become more aware of our sanitary, where we're washing gloves. When we get our mail, they tell us to put a glove on. And even if it's a gardening glove, something to protect you, not just a fancy, operating room glove, something to protect yourself. Open the mail with 2 gloves, use a knife, take out the interior contents, and throw the envelope away. That's what we're hearing, and that's what we're practicing. We have to use our best instincts. Everybody's coming up with new ideas. A neighbor of mine sent a message the other day, and perhaps you've seen this limerick on Facebook, sent a message the other day saying, "Today is garbage day. I have no idea what I'm going to wear when I go outside." So people don't know what to do. They're inside all day long with the same 1 or 2 or 3 people, and they're protected. I did my shopping as a senior, barely over 60, just on, Monday morning at 6 a.m., and I was out by 6:45, and I don't have to go back for 2 weeks. Even my milk is dated April 17th, so I'm in good shape. So I might be eating Spam, or I might be eating manwiches or soup by then, but you know what? I'm good if I had to be for a whole month. And I encourage everyone else to not only do it internally, as you may all do listening to this call, but to tell your neighbors, tell your friends, look in on your neighbors. I'm in a neighborhood where I'm here in Washington, D.C., and I have 8 people within a half mile from me with the virus. I'm adjacent to American University in the Northwest D.C. section near the embassies, and 6 students at American University have the virus and are resident they're sequestered in their resident halls. And 2 of my neighbors, a couple in their 40s, are both attorneys, and they have the virus. And of course, I'm home. I bring out the trash. I pick up the mail. I go to the store. Everything in my life is 45 minutes, except in the evening, I walk in the middle of the street, avoiding other people, because that's what they're trying to do as well. So it's a whole different way of life, and we have to be cautious about everything we're doing. And we all know that. So these are a couple of articles that were written in February 23rd, which is about 6 weeks ago, 5 or 6 weeks ago. And they were saying, the World Health Organization was saying, the window of opportunity is there, but the window of opportunity is narrowing. We need to act quickly before it closes completely. And then the person in charge of the Center for Disease Control and Prevention said it was very possible and even likely that it would happen. And as business continuity professionals, or folks on this call that have an interest in business continuity and others that will hear this message in the future, we still have time to take action. If you don't have a business continuity plan right now, you can get a plan online. You can get a plan from other resources. Send a note to the chamber, send a note to me, whatever it is, and we can help you get that ore back in your canoe before it reaches the bottom of the river, so you know what you're doing for the remainder of that ride. Because right now is a great time to do a plan. We're at home. Many people can't do their typical work. They don't know what to do. They're running out of time, running out of patience. They see different situations developing on the news all the time. And maybe they do want to use this plan where they're really in a vulnerable position, say, oh my goodness, who do I call? What do I do? To write a plan and put something together and get it down, or seek help, or work with their healthcare provider to make sure they have something in place so they know what to do, because we probably have a long way to go, and we're doing our best not to make it a long way to go, but we don't know enough about this virus to see what will happen. So it is still time, plenty of time to act on that. Here's another one from just within a couple of weeks. So a week ago, France ordered 250,000 masks, and 5 days later, they wanted 1 billion. That's how quickly things are moving. And that's how quickly it's going to move and continue to move here. And I'm not saying anything that you don't know already. I'm sure we all watched the news last night, and we heard the estimates that there could be a large number of Americans that are fatalities in a very short period of time. And that's the way this tsunami of a menace is moving. And we know this. We've been watching it, we've been seeing it, and we know what's coming, and we have to kind of put on our seatbelts and do the best we can. So I think that's enough doom and gloom for now. Let's get to some solutions. So do you have a plan in place? What would you do? And how could you run your business from home? What would it take for you to have any considerations about that? And if you're just backing up your data, it's only disaster recovery. It's okay. So I'm Dr. Petty. I've got my phone. I've got all my data in my phone or my PDA or what have you, or my tablet on my PC, and it's got everything I need to have my business. I know who my contacts are. Do I have my doctor's office calendar? Do I know when the blood is being delivered? Do I know when the blood is being picked up? Is my appointment book confirmed? I called the doctor with whom I had an appointment just this morning, because my appointment's in 2 weeks, and they immediately put me into a site that's allowing for a doctor's appointment over the PC, something that would be very convenient for me and something that makes a lot of sense. So can you really run your business? So when we look at this wheel or this circle of business continuity, you could be a 2-person coffee shop or a Fortune 100 company, and your priority always at the top of the curve is protect your employees. But to do that, you've got to test them and train them to make sure they know what they're doing. And there's plenty of programs out there. We work with a lot of HR organizations to make sure that people know where the vulnerabilities are, who the new people are, who the people that are leaving on a legacy basis are, and what they knew, and make sure everybody knows. You want to keep your business running. After everyone's secure and safe, keep your business running. We'll go around the wheel. Is your supply chain prepared? That's number 3, because it's got to be critical. Is your supply chain available? Will you serve the coffee with cream? There's no cream, you can't open up. I was in New York for Hurricane Sandy. I had the pleasure to be a spokesman on one of the TV networks, and the Dunkin' Donuts downstairs from where I was staying closed up on the second day, and that was when it really hit home that this was a serious incident. I'm being a little facetious, but the little things in life that people cling on to, and then you go around the wheel in the 5 o'clock position: ability to access your vital records, engaging all your departments, crisis management. It could go right up at the top, but when something happens, you've got to say something internally and something externally, and then keep people apprised of what is happening as the events develop. Public-private sector coordination, food, medical management, relocation. After a couple of days, it could be a day, it could be a week, you're working from home, and you've had an incident in your facility, a fire or a flood or a terrorist activity, what have you, you need to go somewhere else. Did you talk to your building management company ahead of time? Do they know you're looking for 12,000 square feet to manage 20 people with certain loads of power and other conditioning? You have to do that ahead of time. So here are the different definitions of the terms. So business continuity really is the table on which you put everything. Your business runs, and there are four or five pillars to that. One of them, as I said, is disaster recovery. That's your data backed up. That's your rerouting of your phones. That's your IT department, your records management. That is critical. That is the blood running through your veins. But you need to have your skeletal structure and your infrastructure in place, and that's business continuity, to make sure that you are available, you can work. Below that says emergency management, getting your people out, public and private sector coordination, crisis management on top. And these are not in any special order, except number one is always business continuity. Crisis management, make sure that everybody is prepared and the messaging is correct and it's going out the door properly. Supply chain management. If I mention two words the most in this presentation that you're going to take home with you, it's all about supply chain management. The things you can't control, the companies you need to vet that are going to make all the promises in the world that they'll be there for you, and when they can't show up because the dog ate my homework or something else happened, it's not good enough. When you test your plans, you need to test with your supply chain management to do a testable business continuity plan that they match up to, not pinging them or not a disaster recovery test or not saying, okay, we'll be there. Really important. And the last bullet just says how business continuity really is not anywhere near just disaster recovery alone. So if you're missing any of these components of the previous two slides, there's a pretty good chance that your disaster is going to affect your business at a point where it'll fail. And you're going to be at a point where you're going to have to say, oh my goodness, our backups weren't complete, our supply chain wasn't vetted, our emergency management training was not in place, and our crisis management delivered the wrong message. Let me give you an example about emergency management. Long before Newtown, Sandy Hook in Connecticut, I was with an organization that did a mailing to 180 different schools in Connecticut to provide terror training and active shooter training. And about 15 or 20 schools came back and said, okay, we're interested. And one of those schools was in the Hartford area, then another one was in White Plains, their headquarters. So we did work in White Plains, New York. And they had two campuses. And we went there for the visit to make sure that we would be able to work with them and everything would be fine. We met with them, and one of the precepts of working with these organizations is to invite the police, fire, and ambulatory services to this event so that these people can be a part of this 2-hour presentation. And we split up the group. We did 2 hours in the morning, and the other half of the company was 2 hours in the afternoon. So in the morning, we sent a message out to all these groups. We confirmed, we made a phone call, and we said, please come to the ABC school at 9 o'clock for our session. And the police department, the person they sent went to the wrong campus. There were two campuses. There was let's call it the northern campus or the upper campus and the lower campus. So in times of an emergency, if they called and said, this is the ABC school and we need you to come, we have an emergency, would they know ahead of time to think that go to the upper or lower campus? It's possible that they could not. The psychologists say that when there's a disaster event, you have 30 words for 3 thoughts in 3 sentences. So that could be, we're having an incident at our facility, we're contacting the authorities to make sure that we're okay, and we hope that everything is resolved shortly. And then enough people know that there's word that went out that the cavalry's on their way. So we want to be crisp that you know what to do and who to call when something like that happens. So the police were wrong that they went to the wrong campus, and it was something that made everybody really take another look in the mirror and say, okay. So whenever we sent because we were culpable by not saying go to the upper campus. So whenever we sent our notes out, just like today, Shannon's done a great job of coordinating with everyone, and we spent 20 minutes practicing, and people are on board, and we're doing well. If we didn't have that attention to detail for a simple call like this, how can you have that attention to detail for a company that's supplying services to the community, is a viable business, and has a full-time staff of employees that have their livelihood with that company? It's something really to think about. So for your plan, as we were saying, you really want to protect your employees, keep the business running. Some of these are redundant, but let's talk about some other ones on the right. Your HR, operations, logistic, and other organizations really need to be at the table. You have to have someone that's involved with your compliance and your audit if you're a little larger firm. In terms of communication, we're somewhat of a small company, and if FedEx went on strike tomorrow, I have an account with UPS United States Postal Service, and I think I still have a DHL account. So I won't be trying to find an account at UPS because FedEx is on strike, because I'm setting up ahead of time my communication carriers. I'm in a home right now, and I have Verizon as my wireless carrier. We have Comcast coming in for the TV, and someone else in the household is using another version of a carrier. So you've got redundant carriers in my home during this time of crisis, and it's something that business needs to think about. I talked about public-private sector coordination, food and medical management. We know that Readiness Associates focuses on the healthcare industry, working with hospitals, doing whatever they can to help provide plans and preparedness programs for medical systems. That's a key feather in their cap, that they're taking on that critical area. If I break my thumb walking out to get my mail today because I slip on a curb or something, and I have to go to the hospital, and they say, end of the line, Mr. Petty, because we have so many other patients that are more important than you, I've got to sit there for a while and worry about what's going on. But a company that helps people think things through is important. And then I said testing, training, and exercise at the bottom. So this could be as extreme as we've ever seen. So as your company have contacted the Red Cross or any other companies to say, okay, we're in a pandemic and we're a restaurant, what can we do to help? What can we do as resources? Is our street closed? I understand that as of last night, that Maine, let me get the verbiage right here, Maine has become there's been a shelter-in-place mandate, that right now you've got a shelter in place, and that's something that you need to do and make sure that all the employees are staying at home and doing what they can. So that's a critical thing that needs to be done. So all these different factors are on this slide. So have you checked in with your insurance coverage? Take a note and say, call my insurance company and find out what we have in terms of coverage. What's covered? Your extra expense insurance, your insurance that talks about different things in terms of liability, where you are, business interruption insurance. Those are all carrier-led policies. There are even some policies, I understand it, that are now helpful for the pandemic, some of which are brand new. Again, we're in the canoe and we lost our oar, but we're only a third of the way down the river. Let's get on track. Let's make that call now and figure out what you have and what you need. Supply chain. Here's an article that's interesting. This code came out again in February when we had no idea what this pandemic was going to look like. So this code is, I guess, 7 weeks old by now, 6 or 7 weeks old by now. And it talks about all the losses of the things that are going to happen and all the things that are going to be triggered. What could be happening in terms of your coverages, both internally and externally with your third-party supplier. So it does say that from this Aon group, one of the largest insurance firms in the world, that in the property risk consulting group, that there could be effects, there could be delays, there could be some physical damage. A lot of things could happen. And guess what? Pretty much all of them have happened. We can't say that we've had physical delays where there have been fires and floods and what have you, but we can say that there's been impacts to facilities and the ability to work normally. And that's something that certainly has happened.
Ralph,
so, yes.
Sorry, on that point, we hosted a call with a local attorney last week. And one of the things that he noted was that after the SARS outbreak in 2013, they did come up with insurance policies that cover pandemics and illness, and that they're very expensive, and that you would likely know that you have added it onto your insurance policy and that it's not likely included. So it is a question to be asking, but it is unlikely that a lot of what your impacts are right now is going to be covered by your insurance policy unless you've taken that extra step. Right,
unless you had it before. But guess what? Thank you, Shanna. But what's happened is you're planning to handle this event, but you're looking at the next event. That's the key, because all hazards planning, you may have a rainstorm in May, you may have a nor'easter in October, you may have a winter storm in December, and that's going to affect everyone involved in these calls. So that was an excellent point. Thank you. So it says here that it talks about the companies being affected. CMS, which is the organization for the federal government that deals with the Medicare and Medicaid, talks about that this all hazards approach is integrated. So your elders and other folks that are looking for different services, what have you, they've been on board. When the president's been speaking in the evening, they had Seema Verda, I believe her name is, who's in charge of CMS, that's come on board to speak to the tens of millions of seniors out there about the coverage that they would have. Many of these folks are homebound. We've heard the stories about the tragedies of people being in assisted living facilities and how if one person gets sick, it could go like wildfire. I know in Maryland, for example, there were 66 people that were affected that had the virus in one senior care facility. As of this morning, there were 5 deaths. There had been one a few days ago, one a few days later. Yesterday, there were 3. So it's starting to mature a little bit. I use that word mature as being more forceful in what's happening there. So have you really tested your plan? You know, is FEMA going to come in and save you? FEMA says you need to be prepared for the first 24 to 48 hours, you know, kind of survive on your own. Unfortunately, our 24 to 48 hours may last a month, sequestered at home. But have you really tested your plan? Can you speak to an event that you've had? Do people in your firm know about what to do? Were they involved? All the departments. I served on a project in Connecticut last year with a commodities trading firm, and we met with the senior people in every organization and built bridges and actually came up with something called a workflow enhancement, where they had a report every Monday morning and 4 different departments got a single report, and we made it a common report. Why wait for the common report after disaster? Why don't you get to know what's going on in a common report before disaster and have less disruption in the whole scenario? So it's something that you need to look at in terms of your business processes. So here's the FEMA example. So when FEMA was called in for Hurricane Katrina, their response was delayed. And even the Chicago mayor stepped up and said that he was shocked of the response. And that was FEMA does a great job. We work closely. I'm FEMA certified in a number of their disciplines between FEMA and Homeland Security and all the other federal agencies in cooperation with all the state police and other state and municipal employees. They're all doing their best. And you know, sometimes things fall through the cracks. And there were some specific noticeable items that happened in New Orleans with Katrina that prevented the cavalry to get there a little more quickly. We're not going to go into that, but the bottom line is that you're hoping for FEMA to come in, but is FEMA knocking on your door while you're working from home today, or is FEMA helping your company? They can if it gets the broader picture, but individually, we're kind of on our own and we have to do whatever we can. So what can you do? What now? Well, like I said, it's not too late to get started and jump in with a business continuity plan. They're out there on the internet. They're out there as a resource. You can contact the chamber. You've got my name. Google me. You'll find me. I can help you get pointed to it. Contact your local supply chain people and say, do they have a plan? In Philadelphia, we work with a company that was building this Comcast tower, and they were worried about their 5 key suppliers. And we helped write plans for them. So you want to make sure that everybody's in place to make sure that you have this all hazards planning. I think I went too fast. Here we go. So you've got to respond. Something's happened. You've got to make note of the situation internally. You have to have in writing what to say. You have to have the top level person say it. So the person who's the head of an organization. I use Readiness Associates again. Michael Boardman is their CEO and founder. Now, Michael's the one that gets on the phone. He's got the highest level of integrity and the presumed highest level of knowledge of the situation. And he has to send his message out first internally and externally. And guess what? They're going to be looking for him. When the president gets on TV every night, he's surrounded by 3 or 4 of the same people. So there's a continuum of the right resources. The people that have been there before are there again now, and they need to stand there and provide the services and provide the solutions of what's happened that day as things are changing, to act decisively and to understand from an authoritative perspective what they need to do. And you have to take that, internalize that as well. So post-disaster, and we're not post-disaster yet, but were key people available to work through your situation? If it was not help related, did you miss a service level agreement or deliverable, or did you miss a deadline? Are you a small company? So what did you do? And for larger companies, was there a formal crisis management team that stepped in and ran their department and did what they ever needed to do? You take a look back. You start jotting notes now. When you do a test, I know there's some larger firms on the phone here. When you do a business continuity test and you get a 97% success rating, you failed. 3% of that test failed. And the next time you go back and test again, be it informal or formally with an IBM or a SunGard or a major corporate player in this business, you want to test that 3% to make sure it's right. But if you take your eye off the ball and focus on the 3% and mess up somewhere else, that's why you have to test at least annually, or at least make sure that you have an understanding of your plans being updated and people know what to do. So can you answer these questions? They're rhetorical questions. Who has already conducted the training for you in your office? What resources do you need? These are the questions you take away from this presentation, that you go back and look at these 6 questions and say, are you able to say yes, or are you able to put a name in for each one of these questions? The who, what, where, when, and how. I mean, who did it? What was done? Where did it happen? When was it done? I walk into businesses right now as a business continuity certified professional, and I'll have somebody with a Y2K plan. And that was funny 10 years ago, and now it's been 20 years since Y2K. And we all remember it well, when the world was going to collapse and the millennial was going to drop everybody underwater. But guess what? Some of these companies are still in the same location. They still sell widgets, and Mr. Smith and Mr. Jones still own them. So in some way, any plan is better than no plan at all. So the skills you need in a disaster event, if you get down to the last slide or two. Yes, Shauna.
I just want to give you and others on the call or on the video the opportunity to interact with each other and answer questions. So this is just a courtesy 10 minutes left time frame for you.
Thank you. And I'm doing well with 3 slides to go. So we're in good shape, plenty of time for answers. Thank you very much. So these are the skills you need. You have to work under stressful situations for extended period of time. And these come right out of the FEMA and DHS Boy Scout manual, if you will. You have to communicate effectively, both orally and in writing. And you can read the rest. I'm not going to read them all to you. And those are the key 5 skills to the left. There's other desired skills. And you really need to understand what you need to do to run your business. The chamber, I've been a member of 17 different chambers of commerce in my career, as I said to Shanna earlier, and I think she likes me a little more for saying that. And the whole key is that whether you sell stationery or whether you build cars and trucks, your business is very important to you. It's your livelihood. Many companies have family-owned businesses, and a whole family works for them. I have a colleague that is a husband and wife team right now that they're both out of work because they're not getting paid because the company went out. So it's not that a spouse is the breadwinner, and maybe their business is a little different. So you really have to look in the mirror and take this opportunity to reflect on what you're doing, what your business has, and how you need to be successful. I think our last slide says the last word. It must be the last slide. You know, you have to just be ready to go and communicate, as we're drilling into you over and over and over. It's unlikely it could happen to you, but look at the 3rd bullet. No one expects a car crash or a hospital stay or a fire or any event or clicking on Staples 20% discount and ending up at a terrorist site that's doing phishing. That's a cyber attack. So we always have to be aware of our surroundings, make sure that we act appropriately, and then just make sure that if something happens, we're able to respond to it. But the only way you're going to do that is to be prepared and to make sure that you're on top of it. So for this whole pandemic event, and there's our host, I'll leave that one up there. For our whole pandemic event, the key is that we're in the middle of it. You've got to deal with it. You've got the time to deal with it, and call around and find out, do you have a plan? If you don't know if you have a plan, you don't have an effective plan. That means that they didn't tell you about it. And what are you going to do? How are you going to react? So I'll leave you with that thought, and I'll thank you all for your participation, and I'll welcome your questions. Thank you very much.
Thank you so much, Ralph. I don't know if Mike wants to say anything, and I can unmute our participants or encourage them to unmute themselves. And I certainly could bring forward a question or two that we've been getting from our members in the last couple of days. But before we go there, Mike, is there anything that you want to add as a kind of our local contact for Readiness Associates?
This is Mike, by the way. Ralph did a great job presenting. I just want everyone to know, and some of the feedback that we receive from some of our healthcare partnerships is that there's a lot of businesses out there who are really concerned about what do I do to get started and to engage in any kind of business continuity plan. So please feel free to call with even what you might think might be the most basic questions so we can help you get started.
Thanks.
Thank you, Mike. I'd like to comment on that, Mike, because, you know, the way that I'm partnering with Readiness Associates, generally as a business continuity person, and you're a specialist in healthcare and finance, insurance, and some other areas, we all have to work together. We all have to find our partners, and we all have to figure out a way to see what we need as resources. And I can't remember a time, 33 years in this business, where we really need each other more than ever to just dialogue and talk and just exchange ideas. Because that idea I had about getting your mail came to me from someone in my neighborhood that heard it at work. And I've said it to 100 people in the last couple of days, and everybody's like, oh my goodness, you know, we really need to get our mail with gloves on or whatever. Some little thing that can make so much of a difference. So it's important to make sure that our networks, both personal and business, are being extended even further than they were before.
Thanks, Ralph.
Any other questions? Go right ahead, Shanna, please.
Yeah, well, and I would note we've got a couple folks joining by phone, and so just a reminder that you can unmute yourself, or I can help you unmute or unmute everybody. But I want to give a chance for some questions to be asked and some interactive dialogue before we close out our webinar. Are there any questions from participants? Not seeing any or hearing any.
I want to ask you a question, if I may, because we still have a couple of minutes here, 3 or 4 minutes. If there's anyone that's unmuted that's been through a disaster event, and I'd asked some of the folks that were on the call that I invited to, in the interest of time, to not kind of interrupt the flow of the presentation and take questions at the end. But if any of the folks that I know or any of my new friends on this call have been through a disaster event and want to talk about it, that might be something that could generate some discussion in the last couple minutes here.
Yeah, and I'm going to unmute everybody in case anyone's having trouble with that. So just a word to the wise, I'm unmuting you. If that's something you don't want, be prepared to mute yourself again. There we go. And everyone's unmuted.
Okay.
I can bring forward a question that's been coming up both internally in my team, and we're hearing from all of our members right now. And so I think one of the things that we're noting is a need, particularly in smaller organizations or team sizes, to build in redundancy amongst tasks and amongst teammates. And a lot of us are doing that on the fly right now and doing it remotely, which isn't always the ideal way. So anything that you'd want to speak to that about?
It's Ralph. I'll take that. One of my first slides talked about having a plan A, plan B, and plan C, and that really is all about the redundancy. So that if you do lose communications, or if I don't get my FedEx package shipped, you go to plan B or plan C. But for all of us now, are your supply chain people available for you today on April 1st? And we didn't have any April Fool jokes. This is all true stuff here. But are any of your people not responding to you? Have they disappeared? People you've depended on, or they're not able to serve you? That's a pretty good test to see if these people are really going to be there for you when the chips are down. And boy, are the chips down now. So you might want to think about some alternative solutions or alternative organizations that might be working hard to get your attention, but you've been working with the same old firm for 20 years. You may want to say, you know, what can you do for us? And how would you impact us successfully? So I think that's a great question, because looking at alternate plans from different organizations, this is a great time to do that.
Thanks, Ralph. Other questions?
You bet.
Doesn't appear we have any. I'm going to give it one last call, and I'm not going to make any of you stay on or our presenters stay on if there isn't anything to ask. I haven't seen any in the chat. Anyone on the phone joining remotely that has a question for Ralph or Readiness Associates? All right.
Okay, well, thank you all. I'll say thank you before Shanna does, but I really enjoyed this. I spent a couple hours on it, and it really made me think of the basic elements that even gave me some new ideas, even though I've done this a couple hundred times. It made sense to really think about this, and I'm glad that everybody has an understanding. And again, we're all resources for one another. Call Mike, call me, call the chamber, whatever we can do to help, absolutely we will. Thank you all.
Yeah, and just I can't thank you enough, Ralph and Mike from Readiness Associates, making this information available to us. We've recorded this webinar. I'll be following up with Mike, and we'll be, everyone who registered gets a thank you email with the presentation, the recorded webinar, information and ways to connect with Readiness Associates and Mike directly. And so we'll be making all that available to you, which also means if you have any questions that you would like addressed in a follow-up, you are welcome to email them directly to safe@readinessassociates.com or to me at the chamber, shanna@lametrochamber.com. We'll get those responses out to you as quickly as we can. Otherwise, thank you for making time today, both to our presenter and to Mike and his team, as well as each of you who joined us. And be safe. Thanks, everyone.
Okay, thank you. Bye-bye. Thank you so much.
Thank
Have a
you.
good
Chin up.
day.